coming up on Healthy Minutes with Dr. Mo.
Acne, what causes the common skin disease and how can we fight the zits away? Learn about the up-and-coming PRP therapy and its benefits in fighting skin aging. What home remedies can you use to keep your skin vibrant and healthy? And how should you act if you or a loved one get burned? Hello and welcome to Healthy Minutes, the program that talks about your health. I'm your host, Dr. Mo. Today we're going to talk about the largest and fastest growing organ in your body. An average adult carries about 2.6 kilograms or 8 pounds of this organ, spanning over 2 square meters or 22 square feet, and accounts for 15% of our body weight. If you haven't guessed it yet, that will be your skin. Now, other than being the most prominent, aesthetically appealing feature of your body since it covers every inch of it, the skin has a lot of major important functions. So why don't we leave you with this small illustration to show you the major functions and composition of your skin, and we'll be right back.
Visit our website, healthyminutes.tv, or follow us on Twitter and Instagram @healthyminutes.
Our skin's primary role is to act as an interface between our body and the environment, protecting human life from toxic substances, UV light, heat, and microorganisms, and it's also the most extensive sensory organ in the body for the detection of touch, pain, heat, and even the start of vitamin D production. Our skin is 1 millimeter thick and consists of 3 primary layers: the epidermis, the dermis, and the hypodermis. Each has its own function depending on the structures it possesses. The epidermis is the outermost layer of the human body, consisting of mostly keratinocytes which produce keratin, a protein that gives our skin strength. The epidermis is further divided into 5 layers. The layers are stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and the basal layer. The basal layer, which contains melanocytes, which synthesizes melanin and is responsible for our skin color. When we shed skin, we start this process from the basal layer. This renewal cycle takes 30 days, and this is the process of skin regeneration. The dermis consists of 2 layers, the papillary and elastic, both containing 3 types of tissues: collagen, elastic tissue, and reticular fibers. Collagen is responsible for the strength of skin and holding it together like glue. There are also specialized glands within the dermis, including the bases of hair follicles, sebaceous glands that are responsible for producing sebum or oil, eccrine sweat glands produce sweat, and several nerve endings for sensing touch, pressure, pain, and temperature. Many of these are also found in the hypodermis, the largest layer of skin. At the base of the hypodermis are a series of blood vessels and lymphatics which regulate blood flow and nerves to receive sensations, and all of this lays on top of muscle. And that's what's going on under your skin. Welcome back. Now that we know a few extra things about our skin, its major functions and components, it is important for us to take up the responsibility and take good care of our skin. Now, there are several quotes out there that spell out exactly that, and one of my favorites is, "Take good care of your skin, you'll be wearing it for the rest of your life." But how do we take good care of our skin? The Healthy Minutes team and I paid a visit to specialist dermatologist Dr. Rania Kayat and brought you these tips.
Basic. A cleanser is a must for each skin type. Either dry, either oily, either acne prone, either with pigmentation. A cleanser is a first step to be done morning and evening. Okay, so cleanser. Then we go to a toner. A toner, yes, it can be plus or minus for each skin type. Oily, 100% I would recommend a toner that will contain a few acids like salicylic acid, something to neutralize their pH and to keep their pores closed. And then some cooling or soothing toner can be used even for a sensitive skin, and really it's very helpful. A sunblock, 100%, I would recommend and highly recommend sunblock. It's very important because Arab people, we are very prone to have pigmentation. If you train yourself to apply your sunblock, it will be a routine. It's very easy. And then you will prevent so much wrinkles, pigmentation, so much. So sunblock, according to your skin, if it's oily, go for the emulsion or go for the lotion. If it is dry, try the cream thing. If it is sensitive, go for the, let's say, the physical or the thick barrier sunblock. So this is a very important. Nighttime, you should go for your night care cream, whatever condition you are having in your skin, and eye cream. Please, ladies, especially ladies, use eye cream.
You're watching Healthy Minutes with Dr. Mo.
Now to an issue that is too close to home, something that I've suffered from for years as a teenager. And according to statistics, 95% of people walking this earth will or did suffer from this at one point of their lives. Acne, zits, pimples, whatever you want to call it. This common skin disorder peaks during your teenage years and could continue well into adulthood. Actually, 14% of women suffer from acne well into their 40s. But what causes this disease? And how do we fight the social stigma and psychological ramifications associated with it? Let's take a look.
My acne makes me feel so self-conscious that sometimes I don't even leave the house.
I hate how everyone assumes I have bad hygiene just because I have acne.
The other day, a little 8-year-old pointed at my acne scars and loudly asked his mom, "What's wrong with that girl?"
When I take selfies, I have to take them from a distance because of my acne.
Sometimes I feel like if my skin was clear, my life would be different. I'm sick of hiding behind makeup.
My ex dumped me because I refused to cover my acne with makeup.
I don't even take off my shirt because I have acne on my chest. I feel so disgusting and ugly.
Sometimes when I'm talking to someone, they'll stare at my skin instead of looking at my eyes.
I have acne and it's so emotionally stressful. It's brought me to tears countless times. I just want to feel beautiful.
Acne is the most common skin disease in the world, but what causes it? The pores in our skin are openings of follicles for oil to travel up and moisturize our skin and hair. The oil is called sebum. When you rub your face with your hands, you may push dead layers of skin and bacteria over your pores and block them. Creams and makeup may do the same thing. When the pores get blocked, the sebum becomes trapped inside, forming a good habitat for bacteria to grow. As the pressure builds up, the follicle expands like a balloon. Body's white blood cells that attempt to solve the problem, causing further inflammation, what we see as a red dot on our face. Now, when this mixture is trapped under our skin, we get what we call a whitehead. If it manages to make an opening to release its contents to the skin surface, then we get a blackhead due to the melanin in the sebum being oxidized. This blackhead is not dirt and can't be cleaned as such. Sometimes the expanding follicle ruptures, causing inflammatory acne. This rupture may be caused by touching and picking the skin, so it is important to leave acne-prone skin untouched. Acne mostly affects us in our teenage years because of the hormonal changes that causes the sebum production to go in overdrive. But acne can affect us at any age, especially when we're stressed. The stress hormone cortisol has similar effects.
Consider this as a step. You should start from step 1 and go upward. So step 1 is taking care of topical skincare. And by saying that, I mean cleanser, a very good cleanser containing maybe antibiotic, maybe some keratolytic like acids that will peel off the dead skin. And then you are talking about a toner, which will keep your pores closed. So that's very important as well. Sunblock, because people who's having acne, they will have a pigmentation as well, a dark spot which they don't like later on, and this is also a very important point. And creams, whatever creams or lotion the doctor is prescribing, whether it's just peeling off your skin to prevent the pores from being clogged by whatever bacteria or dead skin, or maybe it's antibiotic, or it could be just acids that also will cause a very good anti-inflammatory effect. Step number 2, you go for something that we will treat from inside, which mainly we are talking about 3 points, which is the antibiotic, and we have several antibiotics. And then we are talking about hormonal therapy, which is very important for especially patients who's having hormonal imbalance. And the third is the isotretinoin, which is very common in Bahrain, Roaccutane. Then you can go into many different things, because science is exploring every day. So you can talk about plasma therapy, the PRP. You are talking about laser, acid peels, so many things. Even LED, which is just a light therapy, helping to control the activity of the bacteria on your skin. It can be very helpful.
Coming up next on Healthy Minutes with Dr. Mo.
Learn about the up-and-coming PRP therapy and its benefits in fighting skin aging. What home remedies can you use to keep your skin vibrant and healthy? How should you act if you or a loved one get burned? Hey there again. Now, a new and upcoming treatment that has been achieving much attention lately is PRP, or platelet-rich plasma procedure. Now, in PRP, the experts would extract the plasma from your blood and re-inject it into your face, neck, or area of treatment. Experts say the growth factor in plasma helps rejuvenate the skin, fights off wrinkles, stretch marks, and even acne scars. So we paid a visit to consultant plastic surgeon Dr. Nadia Matar and filed this report on the workings of this procedure.
Our blood plasma contain substance called platelets. Platelets, what will do in the body? It releases clotting factors plus growth factors. What is growth factors? Which is the main things in the PRP therapy. It's a protein. Protein will enhance the healing, and it will rejuvenate the skin, because it is a safe procedure. So there is broad category of people who can benefit from PRP, either a therapeutic purpose or for cosmetic reason.
Can you walk us through what is done exactly when someone comes to the clinic for PRP?
We use a kit with the drawing of 20 ml of blood. We took this blood and we keep it in a special device called centrifuge. Centrifuge is a device will separate the plasma from the red blood cells, which we don't need it in this procedure. The plasma, we withdraw it through very fine needles, and then we inject it to the patient's area of concern and therapy. Before we inject the patient, we have to keep an ointment, which is local anesthesia, for about 30 minutes. And then we have to inject so the procedure will be painless or pain-free. PRP is safe, straightforward. There is no complication in expert hand. And if complication happen, it is just minor, which is redness and ecchymosis, providing the surgeon or the doctor, cosmetic doctor who's doing this procedure, he knows where to inject. It's just a superficial injection. The main questions will be, what's your problem? Is it dark circle? Is it post-acne scarring? Is it just for rejuvenation? Is this an old lady, she wants to get rid from wrinkles? International recommendation that's 3 sessions, minimum of 4 weeks apart. For me, in my experience, I do them in 6 weeks apart, and I saw a very good result actually. Actually, my advice to my patients after PRP that they have to keep ice pack around the area, and especially for the ecchymosis, especially people who did PRP around the ice. And the second things that they can resume their activity. There is no restriction at all. In case of any reaction happens, they should seek the medical advice.
You're watching Healthy Minutes with Dr. Mo.
Welcome back. As much as science and medicine advanced throughout the years, the natural ingredients of the earth remain a major component of many skincare and cosmetic products. These have been used since ancient times and still remain part of many men's and women's skincare routines. We at Healthy Minutes opted to do the research and bring you these natural and alternative remedies. Although these might work, they do not substitute visiting your doctor if you have a problem. Having said that, let's take a look at what you can do at the comfort of your own home to get clear and healthy skin. The quality and texture of your skin is a result of the skincare regimen you follow and your lifestyle habits. But certain home remedies can be used to improve the overall health and appearance of skin, and here's a few we're going to share with you. Lemons. Now, lemons contain citric acid, which keeps the skin clear by removing dead cells. It also has vitamin C, which helps reduce dark spots by increasing the renewal process. Lemons have bleaching properties too, which would help improve overall skin complexion. The way to do it is apply fresh squeezed lemon juice to your entire face and neck for 10 minutes, then wash off with water. You can do this daily or every other day. You can also rub your face afterwards with cucumbers to moisturize. Some people also mix lemon with honey or sugar to help exfoliate. Turmeric. This is an excellent antiseptic and skin lightening agent that can help with scarring and inflammatory skin disorders. You can mix the turmeric powder with a solvent base like pineapple juice or milk and water and apply it to your face to reduce spots and lighten skin tone. Honey is a great moisturizer and also has antibacterial properties. Apply raw honey directly to the skin, let it dry, and rinse off with water. Aloe vera has many benefits: antibacterial properties that would kill acne-causing bacteria, anti-inflammatory properties that would help soothe irritated skin, astringent properties that would help heal scars, plus it moisturizes skin and stimulates new skin cell growth. Extract the gel from the aloe vera leaf and apply on your face. Baking soda balances pH levels of the skin. It also has mild antiseptic and anti-inflammatory properties that deal with problems like acne and spots. It also exfoliates the skin. Mix 1 teaspoon of baking soda with water or lemon juice to make a paste and use it to exfoliate. Cucumbers are hydrating and nourishing and are excellent for the skin. They can improve overall appearance and add a fresh glow. Cut cucumbers into thick slices and rub them thoroughly all over your face. Leave it overnight and rinse with warm water in the morning. And those are a few tricks. Try them out, tell us which one has worked for you best, or share your own remedies with us and get a chance to feature them on the show.
You're watching Healthy Minutes with Dr. Mo.
Sarah, can you get some water, please?
The hose.
We're just going to put some cold water on it and soothe it.
Cool the burn under cold running water for at least 10 minutes.
Does that feel better? Get me a freezer bag and some tape as well, please. It's been 10 minutes.
Cover the burn with a clean plastic bag or cling film.
This will keep it clean and it won't hurt as much.
Call the emergency services if necessary, and go to your nearest health center or ER room.
I think we need to go to hospital.
Okay, I'll go get the keys.
Okay.
Visit our website, healthyminutes.tv, or follow us on Twitter and Instagram at Healthy Minutes.
Many discoveries and breakthroughs throughout history have helped change our understanding of medicine, improve our treatment of disease, and prolong the lives of our patients. On this show, we will feature these great discoveries of all times and look at the stories and people behind them. So let's take a look at what we have in store for you of great discoveries on today's episode. 1940, World War II is building in Europe, casualties are mounting in Britain, medical care in the front line and in the cities are rudimentary at best. One major problem, dwindling blood supplies. A young doctor working quietly at a lab will help create a life-giving solution. In 1928, Charles Drew, a young college grad from DC, begins medical school. Since most southern medical schools in the United States will not accept black students, he attended McGill University in Canada. It is at McGill he began experimenting with blood transfusion. 5 years later, he graduated near the top of his class. In 1935, he landed a job at Howard University to teach black doctors. He did not see race as an excuse. While at Howard, he won a research grant to study blood preservation at Columbia Presbyterian Hospital in New York. There he begins to explore the separation of blood components for use in transfusions later. By 1940, as Drew was working, World War II has consumed Europe, and his work has taken a new urgency. One day, he gets a call from an old teacher at Columbia University and asks him to be the director of the Blood for Britain project, which calls for the delivery of blood on an enormous scale, something that has never been done before. Drew threw himself at work. He took his small experiments and transformed them into a mass production operation. Soon, the Brits used the data to set up their own blood bank. By the time America entered the war in 1941, Drew became the director of the Red Cross's blood program. There, he faced a different challenge. The armed forces had a controversial practice of separating blood from white and black donors. In his view, there was absolutely no reason to separate blood other than blood type, and he was right about that. In winter of 1941, he called a press conference and quit the Red Cross in protest of the segregation. He returned to teaching surgery at Howard University. His legacy and techniques continue up to this day to save millions of lives. And so today, we remember Dr. Charles Drew, the founder of the blood transfusion technique.
Don't miss out on our health tips. Visit our website, healthyminutes.tv.
That's it for today's show, folks. Remember to take good care of your skin. Use your cleanser, your toner, and don't forget your sunblock. And also remember that acne is a disease and not just a transient teenage phase. If you have the problem, visit your dermatologist. Contact us on our social media channels or visit our website, healthyminutes.tv. Share your questions, your comments, and your suggestions. We'd love to hear from you. I'm Dr. Mo. Until next time, keep safe and stay healthy.